So this is a summary of how to answer a question on biological approach to treating OCD. So we're going to look at drug therapy for OCD and its evaluation. First of all, with any therapy, you want to start by talking about the rationale, so the underlying reason for that therapy to be used. So the idea is that the biological approach explains OCD as a result of having low levels of serotonin, especially the obsessional thinking. Yeah, the obsessive thinking is related to low levels of serotonin, whereas the compulsive behavior, as you know, is linked more to higher than average amounts of dopamine. So the drugs mainly deal with the cognitive symptoms of OCD, not so much with the behavioral symptoms such as compulsions that might be more appropriately addressed to the behavioral treatment. So that's something just to be aware of, but you don't need to include that in AO1. So the idea of drug therapy, and this is from the Mark scheme, is to correct the imbalance of neurochemicals, for example serotonin, to reduce symptoms associated with OCD. SSRI stands for selective serotonin reuptake inhibitors. An example, and this is just to add extra detail, should you get a 16 marker, you need 6 marks worth of details for AO1. 20 milligrams a day is the typical dosage for fluoxetine. That is an example of an SSRI. And this is significant. You want to include the time scale in AO1 because it's something that we're going to go back to in AO3 to comment on how that has implications for the effectiveness of treatment and compliance with medication. So they work by preventing the reabsorption. So reuptake inhibitors means that the serotonin stays in the synapse for longer because it's stopped from being reabsorbed into the presynaptic neuron. Because low serotonin is associated with obsessive thinking, increasing its levels should result in symptom reduction. And you can say, as a result of less obsessive thinking, there might be also less compulsive behavior because you don't need to carry out the obsessive behavior to reduce the anxiety of the thinking. So the root of the problem seems to be the anxiety. Now, because SSRIs alone might not be enough to generate 6 marks, and also as part of your evaluation you might want to compare different types of drugs, there are a couple of alternatives to SSRIs. SSRIs are the first port of call and the most used antidepressant, but you can also use tricyclics. Now, tricyclics are the kind of first generation drug. So what it means is that they're less specific. They act on more neurotransmitters, not only on serotonin, but also on noradrenaline, and also they're less selective. Yeah, the in SSRI is selective serotonin reuptake, whereas these ones act on also noradrenaline, and therefore they have a potential to have more side effects and have a bigger, broader impact on the rest of the body system. That's why they're not the first port of call. However, if a patient doesn't respond to SSRIs, it might be worth them trying tricyclics. SNRIs, again, they also work on noradrenaline as well as serotonin, so that's what the N stands for, and sometimes they're better tolerated for those for whom, for example, SSRIs have very strong side effects. And lastly, there's a different type of treatment that is benzodiazepines, and what they do is they act on the GABA, gamma-aminobutyric acid, that is a calming neurotransmitter. It kind of reduces the activity, it slows down the activity of the central nervous system, therefore causing relaxation. So they're not acting specifically on the serotonin, they're not OCD specific, but they might help in just helping the person feel more relaxed without necessarily addressing the obsessive thinking, but just feeling less anxious in general. So that's the AO1. We're going to move on to evaluation. As we mentioned, side effects can be a big problem. Indigestion, blurred vision, loss of sex drive. You want to give specific side effects that relate to SSRIs. And then the link back, the implications is that there's a high risk of patients stopping the treatment. As you remember, the treatment takes months to be active, 3-4 months to become effective. However, the side effects might kick in almost straight away. So in terms of that cost-benefit analysis, for the patient initially, they're going to feel worse than before without any benefits of symptom reduction. So it's very likely for a patient to drop out of the treatment before they see the positive effects of the drugs. On the other hand, a positive is that compared to other treatments such as psychological treatments, CBT, psychoanalysis, psychotherapy, SSRIs are much cheaper, and also they're not disruptive to the patient's life. The patient doesn't have to take an hour to go somewhere or to go online and have a therapy session. They can just take the pill within seconds and then move on with their life. However, in terms of appropriateness, remember when you comment on treatment, you talk about effectiveness, do they work or not, but also appropriateness. So talking about side effects and also the kind of type of OCD and the triggers of OCD for the individual means that it's not appropriate for everyone to take SSRIs. For example, if the OCD was triggered by trauma, then the drugs will not tackle the underlying issue. They'll only tackle the kind of physiological sense of anxiety, but without dealing with the trauma, and therefore it's very unlikely that person will feel better and will increase their sense of well-being. Even if their body might feel calmer, their mind might still be in turmoil, and that kind of trauma is more of a kind of learned response rather than a biological innate chemical imbalance. There's a question here comparing benzodiazepines with SSRIs and SNRIs of the long versus short-term outcomes. What is found is that benzodiazepines will have a faster initial effect. So they will work initially to help a person just reduce that sense of anxiety. However, SSRIs are the first line of treatment for OCD because in the long term, they seem to be much more effective in long-term symptom reduction. So this brings us to the key study. Sommer et al. Was a meta-analysis of 70 studies comparing SSRIs with placebo, and what they found was positive, effective outcomes. 70% of patients show symptom decline, but notice this, especially when combined with psychological treatment. 30% need an alternative drug treatment, meaning those SNRIs or those tricyclics or those benzodiazepines, or a combined drug and psychological therapy. So in the next slide, we're going to look at how do we interpret these findings in relation to, how do we link them back to our topic. It supports the effectiveness of drug treatment for OCD because 70% of patients did have symptom reduction, but highlights the limitations of solely relying on this treatment. The majority of patients had an improvement when SSRIs were combined with either a talking therapy or an alternative treatment. This might be because, since SSRIs take such a long time to be effective, a quicker acting drug and or therapy are needed to maintain that motivation. If I'm feeling sick, I'm having those side effects, I'm not seeing any improvement, if I'm not talking to someone about it, or at least having a benzodiazepine that will kind of sedate that anxiety, that might be actually increased by having to cope with side effects, then the likelihood of someone complying with their treatment for those 3-4 months before they see an improvement in their OCD symptoms is very unlikely. So you see here, you're really unpacking the findings, not just saying, and this shows that SSRIs are effective, but layering your commentary, looking at everything that you've kind of built up to now. And the last point, that is a kind of ethical, if you want, point, as well as a methodological question, is the publication bias. We know that drug trials are run by companies that might be funded by those pharmaceutical companies. Therefore, the risk of publication bias is very high. The risk of only significant results being published, where there is a difference between placebo and drugs being published, is very high. Drug companies selectively publish positive outcomes for the drugs they sponsor. Their sponsors are selling, and that means that, as well as being unethical, this means that the validity of not so much drug therapies, but the research that drug therapies is based on, and therefore the effectiveness of drug therapies, is questioned, because all the research that we based our previous commentary on might be not valid because of publication bias. And that should be more than enough to get you full marks in a drug therapy for OCD question.